Well, good morning, everybody. Thank you for joining us today. My name is Patrick Stone. I'm the Vice President of Government Relations and Advocacy at the National Psoriasis Foundation. And I, for one, am thrilled to be here today and moderating this event that is focusing on the Safe Step Act and how the practice of step therapy has directly impacted patients and physicians in the state of Connecticut. We're excited to be joined by an incredible panel of guests, including Representative Joe Courtney and Representative John Larson. Thank you, gentlemen, for joining us today and for your support of the Safe Step Act. Equally important, joining us today are some of their constituents. Dr. Howard Rogers. Dr. Rogers, give us a wave. Dr. Rogers is a practicing dermatologist in Norwich. Dr. Rogers graduated from Washington University's St. Louis School of Medicine, and he's been practicing medicine in the state of Connecticut for over 20 years. Dr. Rogers has seen the impact firsthand of step therapy has on his ability to prescribe medicine and the doctor-patient relationship, and he's going to share some of that with us today. Paula Haney, who's a physical therapist from Wyndham, is here. Give us a wave, Paula. Paula will be sharing the story of her son, Bruce, who was put through step therapy regimen several years ago, and we'll hear how that not only impacted his overall health, but his career. Finally, we're joined by Ben Rader from West Hartford. Ben, give us a wave. We all agree, we think that Ben has the best background in our prep calls. We liked his background. Ben's has Crohn's disease and is going to be going through how step therapy impacted him after a recent flare-up. He's going to talk about his frustration and his passion around the issue. Well, again, thank you all for being here. Some housekeeping before we get started with our program. The chat is muted. There's a Q&A box. If you have questions, please submit those in the Q&A box. We do have some press on hand, and once we get through the presentations, Jen Daly, our media consultant, will be calling upon press to ask questions of not only the panelists, the patients and the providers, but the representatives as well. So let's do a really quick level set on what step therapy is and what the Safe Step Act legislation will do. Step therapy occurs when a patient's insurer refuses to cover the cost of a covered and prescribed medication until the patient tries and fails on different medications, often several different medications. This can happen multiple times, obviously, and as you'll hear, can cause serious medical consequences. Step therapy does not take into account an individual's medical history. It is medical bureaucracy at its worst, and it instead relies upon a predetermined prescription formulary. Something important about the Safe Step Act: it does not ban the use of step therapy, but instead puts common sense parameters and reasonable timelines around the practice. This legislation, as proposed, will give doctors a transparent and standardized process to appeal step therapy requirements for patients with medical necessity in mind as the justification. We always like to build up from the states, and this bill is similar to a bill passed in over 24 states. Connecticut being one of the first ones to do so. Love seeing that leadership. The Safe Step Act, the federal bill, reflects a culmination of wordsmithing and lessons learned across the country. For those of you not familiar with insurance regulation, both state and federal legislation is needed because different types of insurance plans are regulated by state or federal agencies. The bill has overwhelming bipartisan support with more than 150 co-sponsors, including Representatives Courtney, Larson, and Himes. And I can share with you that as of this morning, both Senator Blumenthal and Senator Murphy have committed to co-sponsoring the bill in the Senate side. I can't tell you how pleased I am with that. We've got 2 more congressmen to go in the Connecticut delegation. We want this delegation to be the first delegation that is co-sponsoring the bill in its entirety. The Safe Step Act has a lot of great groups behind it. Over 30 coalition groups of patient and provider groups support the legislation. And it's our goal to not only add co-sponsors, but more to work towards a markup in a hearing in committee. So let's hear from our speakers. That's enough from me. Let's start with Dr. Rogers. Dr. Rogers, please, the floor is yours.
Sure. Thank you, Patrick. When I first started practicing dermatology in Connecticut 20 years ago, writing a patient's prescription was a thrill for me. Treatment plans would come together easily after a clinical assessment of the patient's condition, and the patient would fill their prescription, and his or her disease and quality of life would start to improve as quickly as possible. Isn't that what we all want as patients ourselves? But fast forward to how it works today. I can tell you, the thrill is gone. The excitement that my patient is going to get the right medication right away has been replaced with trepidation. How many hoops will I, my staff, and the patient have to jump through with the insurer to get the treatment that I've prescribed? Will they even get the treatment at all? One of the most egregious barriers that the insurance industry practices put up in the way of patient access to medications is, again, this step therapy or fail first. And again, this process occurs when the insurance company forces my patient to try and fail a different medication that they prefer before providing coverage for the prescription that I've actually ordered. And too often, preferred therapies are delayed or denied. It's disheartening and worrisome for me as a physician, and it can be downright demoralizing and stressful for my patients, which we're going to hear about coming up. More times than I can count, I've seen step therapy worsen a patient's condition, cause additional side effects, or force a patient to abandon needed treatment altogether. I've had to build an extraordinary internal structure in my small business to handle the dozens of hours spent on paperwork, phone calls, involved in the appeal process for these medications. And this really needs to be fixed at a higher level. I hear you that in 2013, Connecticut lawmakers passed a legislation putting sensible parameters around step therapy. And while this will help some patients who have health insurance regulated by the state, the vast majority of patients have health plans that are regulated on the federal level. Large employers, particularly in Eastern Connecticut, where I practice and live, typically purchase those federally regulated plans. So I've seen little relief for my patients with this Connecticut legislation. That's why I'm working with partners from across the country to call on lawmakers to pass this step therapy reform on the federal level. And again, the Safe Step Act is in Congress and it's pending, and it's co-sponsored by Representative Joe Courtney, John Larson, Jim Himes, and our senators Richard Blumenthal and Chris Murphy. And again, I'm calling on that rest of the legislation, the delegation to join in pledging their support for the Safe Step Act. Doing so will allow me to prescribe the care for my patients that they need without delay and preserve that all-important physician-patient relationship. Thank you.
Thanks, Doctor.
Thank you, Dr. Rogers. I very much appreciate that and appreciate those comments. I think one of the things we certainly hear quite often is about the administrative burden, about how many hours you have to spend or your staff spend on the appeal process. Certainly something we're seeking to fix through this legislation. Next, we're going to hear from Paula Haney from Wyndham. Paula's adult son was put through this process, and I'm going to let her words speak for herself. Go ahead, Paula.
Thank you. And it's wonderful to see Representatives Courtney and Larson. Thank you for being here today. As a parent, your instincts are always to protect your kids, no matter what their age. But sadly, several years ago, my hands were tied as I watched my son suffering from a debilitating disease that, even though diagnosed, we were delayed from timely treatment, effective treatment, due to the unfair interference of the insurance company. In 2011, my son was playing semi-pro football. At the end of the season, he noticed swelling that wasn't going away. Now, he was used to postseason pain and injuries, but this was different. As a physical therapist, I noticed that the swelling was different, characteristic of maybe a different kind of problem. He was referred to a rheumatologist who diagnosed him with psoriatic arthritis, an autoimmune systemic form of arthritis that attacks the joints and can leave the patient with severe painful lesions on the skin. His rheumatologist thought he should immediately start on an injectable biologic, but herein was the problem. Before the insurance company would pay for this medication, he was forced to try and fail on a less effective medication for 90 days. This was a medication that was developed in, I believe, the 1950s for the treatment of cancer. Well, during these 90 days, his condition worsened. The pain, the disability, able to drive, stairs were a huge obstacle for him, and his wife even had to help him out of bed in the morning. This is the reality of what step therapy does to patients. When the night, and he obviously had failed, the insurance company granted coverage of the medication his physician prescribed. The effects were almost immediate and remarkable. Bruce was able to continue his career as a high school physical education teacher and a high school football coach, and he even made it back onto the football field, something he sort of had to prove to himself with all that had gone on. Well, there was irreversible damage during those 90 days, and we'll never know what exactly could have been improved if he had started his medication in a timely fashion. But there are many people who have to go on multiple rounds of step therapy, further delaying their access to the proper medication, even more so than Bruce had to endure. You know, we talk about early diagnosis and detection of diseases, but I have to wonder what's the good of early detection if patients aren't able to get access to the medications that their doctors know will treat their condition. I was happy to be on the team that passed the one of the first step therapy reforms in the country here in Connecticut. But as we'll be talking, it's imperative that we pass these same reforms at the federal level so that all Americans have access to the very important care that their doctors recommend, not what the insurance companies will pay for. And our specialists need to be able to appeal the insurance company's decisions in a timely fashion. And those patients who are successful on their present medication regimen, for those patients, the insurance company should not have the power to stop for a less expensive medication. I thank you for the opportunity to tell my story, and I hope it's helpful. Thank you.
Thank you, Paula. Thank you for sharing your story and Bruce's story. We very much appreciate it. And I'm glad he's doing well. I'm glad he's out there doing what he loves.
Yes.
Finally, we're going to hear from Ben Rader. Please share your story.
I thank you all for joining and tuning in on this important topic. I appreciate it. We've all heard the old adage, the definition of insanity is doing the same thing over and over and expecting a different result. Well, I never expected that to apply to my healthcare as well. I was diagnosed with aggressive Crohn's disease when I was 14 years old. At that time, the current therapies and biologic treatments were not available. They hadn't been invented yet. So I was relegated to serious corticosteroid treatments. And when that didn't help, I ultimately wound up in the hospital for a month and underwent surgery to resection parts of my small and large intestine. Now, someone living with a chronic illness, I know that time is never on your side. It's always borrowed. So I had a great period of remission post-operatively, and I controlled my disease predominantly with diet and exercise for about 20 years, which is really good. That all came to an end in January of 2018 when I collapsed on my kitchen floor and wound up having 6 bleeding ulcers as well as multiple disease portions of my intestine that ultimately gave way, causing infection and substantial internal bleeding. So after a week in the hospital and going through a full gamut of testing and imaging, my doctor determined that a certain biologic medication would be very helpful for me in terms of containing and treating the disease in its current form. Now, the insurance company had a different idea. They denied the authorization for that biologic medication, and instead we had to do a 6-month course of steroids, which both my doctor and I knew would not be effective in terms of treating my disease and could actually allow the disease to progress. So what happened is that after that 6-month time period was up, the disease had in fact shifted in my intestines a little bit. And the problem is that once your intestines are damaged, they're damaged. You can't turn back the clock on that. The damage is permanent. So we had to go back and repeat the imaging and repeat the testing to prove to the insurance company that in fact the therapy that they had authorized did not work, and to appeal the decision of denying the original biologic therapy, since that was clearly going to require, my disease was going to require that level of medication. So they did ultimately approve that authorization after we provided evidence to that effect. And I am still on that injectable biologic today, which has done a decent job of containing the disease and allowing me to maintain a lifestyle. But the problem is, during that 6-month period, not only am I still physically dealing with multiple issues in relation to my disease, but it's also taking a mental toll, which is a huge part. It's a huge component of what going through step therapy means. It's not just the physical silo of your conditions, but it's also thinking about your well-being, your health being governed by an insurance company, not by your physician who has a relationship with you. And literally, we were punching the clock to get to a 6-month mark. And as insane as it sounds, almost hoping that the medication that I was on wasn't working that well so that we could get to the medication that we knew would work. So not only does that create additional waste in the system, the potential for additional burden on the healthcare system, because if my disease had progressed even further, I could have wound up back in the hospital. I could have wound up back in the operating room, which would create that much more of an issue. Like Paula's son, I'll never know how much better my situation could have been had we just been able to get the right medication at the right time. But luckily, we have the ability to move that type of legislation forward with things like the Safe Step Act. So I appreciate everyone's time. I appreciate you allowing me to tell my story. And I hope that we're able to give more patients access to the treatments they need when they need them. Thank you very much.
Thank you, Ben. Thank you to our you see we have some entire spectrum covered here: the provider side of things, the caregiver side, and the patient. And I think what motivates me and also frustrates me the most about Ben's story is that it's not like he was trying to get the most expensive drug that was off formulary. This was a covered drug he was trying to get. And the simple difference between the drug that they tried to get him to take, or they made him take, and the drug he wanted to take was that one was preferred and one was not preferred on the formulary, which means the PBM simply wanted to make more money off the preferred drug rather than getting him to a drug that would make them less money. And that's unfortunate part of our healthcare system. And I want to again thank you all for sharing your story. Representative Courtney, thank you for your sponsorship and your leadership on this issue. I open the floor to you to talk about why you are passionate about this issue and why you co-sponsored the bill.
Sure. So thank you, Patrick. Thank you, Dr. Rogers, and who I know has been communicating with my office. Paula, again, good to see you again. And Ben, your story, obviously, once again, like so many other patients all across Connecticut, is really putting a human face on this issue. As I think all of you know, you are actually a relatively small, representation of the patients throughout the state of Connecticut that have been contacting certainly my office and John Larson's office and the other delegation. This is not a really sort of obscure issue. It affects, again, a much larger cohort. And again, I applaud, Patrick and your team for organizing this and including the media to really listen to this story, because it really resonates across a much bigger cross-section of the state of Connecticut. And that, frankly, is one of the reasons why our office was made the decision back in December of last year to get on HR 2274. I mean, this is sort of old-fashioned grassroots, democracy at work in terms of, having people call their member of Congress and telling their story. As you mentioned, Patrick, it's also another old-fashioned story, which Justice Louis Brandeis said many years ago, that the states are laboratories of democracy, and certainly in a whole host of areas of healthcare reform, education reform, other areas. When states move forward and really show success and good results with legislation like the one that occurred here in the state of Connecticut back in 2014, it really, I think, creates a very powerful story for Congress to embrace it and adopt it at the federal level. And you know, again, you could look at countless pieces of federal legislation that, again, followed the lead of state governments that moved forward first. Again, the growing number of co-sponsors, which again sounds like you even had success this morning, you know, is the name of the game. I mean, and John, I think, can echo this. It's a numbers game in Washington in terms of getting to overwhelming force, which is sometimes what you need to move a bill. We're in the closing days of the 116th Congress. And obviously the number of legislative days are going to be very limited, but people should not be, you know, discouraged by that or dissuaded. You know, it takes sometimes a number of years to actually get, you know, the next step, which is to get the committee of cognizance to move forward. I sit on the Education and Labor Committee. We have jurisdiction of ERISA, which is the federal law that Dr. Rogers referred to, that a lot of plans in the state of Connecticut operate under. Electric Boat in Eastern Connecticut is an ERISA healthcare plan for the 12,000 people who worked down at Groton. UTC Raytheon Technologies, another ERISA plan, you know, in John's geographical area. So it does, the job is not going to be complete until we pass 2274. Again, I look forward to working with you and the patient advocates across Connecticut. And I actually am very bullish about the next Congress being much more active in terms of healthcare for a lot of reasons, which we could spend a whole other session talking about. But, you know, with that, again, I'll yield to my good friend and colleague who also has a healthcare jurisdiction on the Ways and Means Committee, John Larson.
Congressman, thank you. Go ahead, Congressman.
Well, thank you, Joe, and thank you, Patrick and Paula and Ben, for organizing this. Dr. Rogers, as always, eloquent. But my colleague, Joe Courtney, is far too modest. He is the go-to guy in the Connecticut delegation, and anyone who's followed his career and watched his work in the Connecticut General Assembly and then has had the opportunity to know from day one, somewhat attributed to the fact that his wife, Audrey, is in the medical profession as well. But the fact of the matter is that on matters of this, and just listening to Ben and Paula's stories, this is a common sense, pragmatic approach that is cost effective and healthy. So why the good? Well, I won't say it. Why shouldn't we just make sure that this passes? And so, Patrick, part of what you were saying and part of the effort here in contacting members, that's a good sized number of members to have as original co-sponsors of a bill. But like anything else in life, you have to make sure that you continue to be persistent. Having Joe Courtney as the lead in the state of Connecticut, well, I can assure you that as soon as you mention Joe Courtney to Dick Blumenthal and Chris Murphy, they both respect and understand and know his acumen in this field. And aside from the fact that I think it becomes intuitively obvious when you listen to your cases that change is needed, and leave it to Joe to sponsor bipartisanly and nationwide, put together the groups in Congress that are going to be needed. But even though that's a sizable number, Patrick's right, we can't stop here. We have to put the pedal to the metal and make sure that like-minded people are recognizing the fallacy of this. I mean, just starting from the premise that you have to fail to succeed, shouldn't it be the other way around? I mean, we want success from the jumps. We want to start right off the bat with what is the best remedy, and who can best discern that? Well, obviously, it's medical doctors, not insurance companies. And so I think, as Joe said, the next session of the United States Congress, I think we feel rather confident that this is going to pass. We certainly are hopeful that a Biden administration will be in place that also has indicated receptivity to this idea and concept, and we look forward to making this bill law.
Gentlemen, thank you to both of you. I appreciate those comments and frankly, the motivation for us as patient advocates and provider advocates and the constituents that we will distribute this webinar to. Those words motivate us even further to continue along what we know is a long process, right? Thank you very much, gentlemen. And I'm going to hand it over to Jen Daly, who's going to guide us through some questions from the media.
Thanks, Patrick. Hi, everyone. We do have a few members of the media on as well. Lisa Carberg is on and working on this story, but she's also anchoring the noon news. So you both addressed her question, I believe, about next steps for the bill. So I think we're covered there, unless there's anything else you'd like to add. I think we're good. Okay.
Yeah.
Yeah, great. So we'll go to Matt from the Norwich Bulletin. Matt?
Hello. Sorry, I was just finding things, managing both taking notes and listening at the same time. But anyhow, this is I think this is for a question more for the doctor. Blanking on his name, the doctor from Norwich. But I guess when did you start seeing this change? Because you said when you started, you used to be a joy to prescribe. But I guess when did you start seeing this change, and I guess why do you think that this change occurred?
So, this change in terms of how insurers cover medications has been, there was no day or year necessarily that things changed, but as medications have become more specialized, the kind of gap between kind of insurance knowledge and physician knowledge and the amount of medical knowledge that comes out every day, I think has been widening. And in terms of insurers feeling like they can control medications and medication expenditures over time, they felt like this was an important part of their strategies. But unfortunately, a lot of the bureaucracy and decisions are made at the boardroom level and not made at the level of the patient-doctor relationship in that exam room. I really feel strongly that when you take a holistic view and look at the patient as a whole, it's really important to trust that physician knowledge and experience and knowledge with the latest medical findings to guide therapy going forward.
Thank you, Dr. Rogers. And I think that, no matter what space you look at, we've seen statistics and Matt, I'll pass along some statistics to you. Jen will pass them along from a couple different disease states where we've seen through analysis of insurance plans, this go up 30, 40, 50% in how much we're seeing utilization management, both step therapy and prior auth being combined, step therapy being combined together. So when you go to get prescribed a drug, having to go through both prior authorization and step therapy is increasingly something we're seeing at a higher percentage. We'll pass those along to you. Thank you for the question.
Matt, anything else?
Yeah, actually, I think of one or two more, if that's okay.
Go for it.
I think for Haney, Ms. Haney, this is it's maybe more of a clarification. But when you're talking about your son, I guess you said there was some permanent damage from the step from delaying the proper medicine. What was that?
Joint damage.
Joint damage.
Psoriatic arthritis tends to affect mostly the ankles, the hands, and the back.
Okay. And I was just thinking in the text of the release, there was alluding to the importance of this considering COVID's ongoing thing. Obviously, it's both medical stuff, but I guess how specifically would that tie into the current pandemic?
I'm sorry, is that question directed at?
Go ahead, Matt. Could you repeat the question, please? I'm sorry. Go ahead.
Sure. Because I think that maybe this. So I'm trying to think who would actually be the best person for the question, but I'm just thinking back to again the press release for this meeting today, and it says in the text of it, during the ongoing COVID-19 pandemic, has become more critical for patients to have timely access to medications to keep chronic conditions in check. Obviously, it's overlaps because it's a medical issue, but I guess what specifically about how COVID is right now does the need for the Safe Step Act tie in?
Dr. Rogers, please.
Yeah. So Matt, this is a great question. I think there's a couple of issues associated with that. One is that with the public health emergency, people have been more kind of unwilling and reasonably unwilling to come into the physician's office. And so there has been some delays in the diagnosis of care. And so people are coming into my office with more acute and more severe illness that needs treatment in a faster fashion. The other issue is that you want to, during a public health emergency, make care as efficient as possible with as few office visits as possible to make sure that patients and healthcare workers are put in as low risk as possible for contracting COVID. And so any sort of a system where you're going to have to see a patient back multiple times and monitor their care on a treatment that may not be effective increases the risk that patient contracts coronavirus because of this process.
Great.
Does that answer the question?
Does thank you.
Great. Thanks, Matt. Patrick, I'm going to do a quick call out in case there's anybody on the list that I've missed in terms of other media folks. I think we're good on this end. Patrick, I think maybe you have a couple questions.
Just one final question for our representatives on the phone. I mean, Matt implied and talked about COVID and how treatment during COVID is different, but advocacy and how we interact with our legislators has changed significantly. And we have accepted the reality that that's going to continue for quite some time. I imagine the speaker will limit meetings with legislators in the Capitol building for quite some time, extending beyond the public health emergency. I'll start with you, Representative Courtney. What advice would you give to constituents and advocates about how to advocate with their legislators during the pandemic?
So again, number one, I think an event like this, which doesn't happen by itself, is a really good opportunity to bring a lot of people together. I mean, the one thing about Zoom is it's efficient. People can actually gather without getting in a car and driving distances, and so you got to sort of play to the strength in terms of the way the platforms that we have right now to communicate. But I also would just say that the lights are on. In terms of members' offices in Washington and in our district office. The Education Labor Committee, which I mentioned earlier, which has jurisdiction over ERISA, we've been holding virtual, hybrid, even in-person hearings. There frankly is already a lot of planning going into effect right now for next Congress. So the timing of this is actually, very good. Because the system just doesn't sort of turn into a pumpkin, with the end of the Congress in December. This process is still ongoing, and so I just would say people should use whatever platform that you can possibly avail yourself of. I mean, obviously, email, phone calls. I mean, again, the lines are open. People are still connecting to member offices, and again, that overwhelming sort of advocacy, which again I know you've done. We've felt it in our office, back in 2019, which was what really kind of pushed this bill to the top of the pile. We've had about 9,000 bills introduced in this last Congress, so you just got to be persistent, as John Larson said. You just got to stay at it, and again, I think the issue of PBMs, which is really fundamentally what this is about, Patrick, because that's really who the decision maker is on this. It resonates, and it resonates on a very bipartisan basis. I mean, and I know sometimes it feels like everything is polarized, but I truly believe in a sweet spot in terms of member concerns, and it's because of the advocacy.
Thank you, Representative. Congressman Larson, any comments, additional comments as we wrap things up?
I think Joe covered it extraordinarily well. I would only add that your stories, they move people. And, I would say 90% of all members of Congress are parents. And when they hear Ben's story, when they hear Paula's story, that resonates with people. And as Joe said, and I'll repeat, it's that persistence, and knowing that you have the backing of the medical community, understanding that this is a very pragmatic, straightforward, cost-effective, and obviously the health results from all of this are, just listening to your stories, nothing short of spectacular. Why not get to that right away? And but to Joe's point, with 9,000 pieces of legislation introduced, it's those personal stories that people pick up, and the lights are on, as Joe indicated. So whether it's our district offices or whether in Washington, D.C., that email, that mail, that phone call, that personal letter, that's all going to get read and responded to. And with the more poignant the stories, usually you'll get that kind of reaction. And then, frankly, again, to have someone like Joe Courtney leading the effort in the delegation is also vitally important because of the enormous respect people have for him.
Well, thank you, Congressman. I want to be respectful of everyone's time as we wrap up here. So, the patient story. I mean, I'll say this: this bill has passed in New York and Texas, two completely different states politically and from a legislative standpoint. And in both those instances, all the lobbyists, all the statistics, they didn't matter. It was about the patient voice. And I was there for both moments. And when that patient voice came across, and as Congressman Larson said, and people understood that this was a common sense issue, that was the impetus to get this across the finish line. So we're excited about continuing this process. We really appreciate everyone's time in the webinar. I want to thank my partners with AAD, with the Crohn's and Colitis Foundation, Jen Daly with Gray Media for helping to host this event. Thank you, everyone, for your time today and participating, and we'll see you soon.
Great. Thanks, Patrick. Thanks, everybody.
Thanks, everyone. Take care.